Hey y'all, I learned something in CT today and I just wanted to share. It's about patients who go under anesthesia, and we have patients who go through anesthesia for whatever reason, right? But mainly it's for them to hold still. And normally it's for patients that are the younger ones, so pediatric patients, because they're scared or they're small or they're just so little that they can't control their breathing and we need them to hold their breath. So anesthesia case is a big thing for kiddos. So I learned this thing where it's called laryngospasm. So it has to do with your larynx, a patient's larynx, and it's essentially where the vocal cord closes and it obstructs the airway during anesthesia. So it's general anesthesia. So it's either the ones where they inhale with like the mouth thing, or the one with the IV. And this is more prevalent in higher cases in children than adults. So the younger you are, the higher the chances of a patient getting laryngospasm. And normally anesthesia cases are canceled if the patient is sick, or if they have any infection or recent throat surgery. I read that it was something about people having COPD will also have a higher chance of having a laryngospasm. But so working with a lot of anesthesia cases, it's important. So what causes this? This is what I learned was what causes this is if the patient is if they're going through anesthesia and they get sedated, and it's when they're going into their deep sleep. So they're transitioning into their deep sleep, or they're transitioning out of the anesthesia, and then they get stimulation from the patient being moved, or even like starting an IV, changing positions or anything like that. That's when their vocal cords can close and obstruct the airway. So it's important that the patient is not sick prior to anesthesia. It's important that the patient is like minimal movement during that transition of going into or getting out of anesthesia. So it's very important to follow the instructions of the anesthesiologist. And of course, as a CT tech, I just don't touch the patient until all their stuff is done. I ask them if they need help. I'll stand back and see, get directions. And then once they do their thing, I wait for them to ask me what they want of me, because then we have to step in and tell them this is what we need, this is what we have to have done. And that's normally after the patients are already deeply sedated. And of course, it's great to communicate prior to the patient being under anesthesia. But yeah, I didn't know that laryngospasm was a thing. Oh, and the way to reverse it. So this is the life-threatening situation. If someone has a laryngospasm, so it's uncontrollable, it just happens. And again, it happens to younger kiddos. So the younger you are, the higher the chances of them getting laryngospasm. It closes the vocal cords, obstructs the airways, and what was I going to say? I was going to say, so the way to reverse it. So the life-threatening situation is that they cannot intubate the patient. So because it's uncontrolled and it constricts the airways, they can't put an intubation in. And since they cannot, they have to give this medication, and it's normally in the anesthesia cart. It's something to reverse. Well, not reverse. It's literally something to paralyze the body. So it paralyzes the neck. It paralyzes everything. So then they can start doing their thing and bringing the baby back. So that's the life-threatening thing. The whole paralyzation and not being able to intubate and give them access to air. So that's why it's important to know about this laryngospasm. It's kind of a hard, long word, but your larynx closing and da da da. So just let them do their thing. Don't cause a lot of motion in and out. And yeah, so I thought that was very interesting and just wanted to share. So there's some info. You guys can look it up, ask questions to whomever. And if you have more information on it, please share in the comments. I would like to know. I just thought it was a very interesting thing that happens in kids, and it's spontaneous, so it kind of sucks. So yeah, stay rad and toodles noodles.